the infection rate has gone down. In 2012, we did Kenya AIDS survey, indicator survey, and we were at 4.3. That is 2012-2013. In the estimates, there is estimate that is given by the national office, and that is the one that was actually even in our bulletin today, and we are at 3.7%. We have 21,428 persons who are HIV positive, according to the data that we have taken up to the month of September. So we have the data of October and November that is not inclusive. And out of it, we have 869 children who are HIV positive. And also we have women, 13,180 who are HIV positive. We have men, 8,249. And we feel maybe the number being low for men is because they are not uptaking the testing. We have issues with men not testing, just like the women or even like the children. Men are not taking testing the way we expected them to take. And for the care and treatment, we are not able to reach them at 95, but we are already at 90%. But for the testing, we are at 67, and we need to test them as much as possible. We have very few men going to the hospital to be tested. Women, because of the nature, like now those who are 15 to 49, you find that those are the women of reproductive age. So what they do, they go to the hospital, they frequent the hospital. However, those men who make it to the hospital, they agree to be tested. One, we have the provider-initiated counseling and testing, and we test them immediately they arrive in the hospitals. However, for fear of unknown, men don't uptake the testing so easily like the others.
The issue of HIV stigma is what is an obstacle to us dealing with this issue. Right now, actually, the disease we are dealing with more than any other one is cancer. And we are able to talk about it. If we are able to keep talking about HIV and we make sure that we remove the stigma and we demystify the whole issue of that illness, we are going to help a lot more people to stop being infected. And then even the ones who are infected, we are able to talk to them, we are able to talk about issues so that they are able to live healthy lifestyles, they are able to take their medicines on time without having to hide, because they assume that once you know that they are taking medicine, you are going to isolate them. Once we remove the issue, the stigma of HIV and AIDS, we are going to be able to actually have a healthy society, because HIV and AIDS is an illness like any other of the illnesses we are dealing with. Let's demystify it, let's remove the stigma so that we are able to keep the people who are infected healthy for as long as God gives them life, and the people who are affected, because if you're not infected, you're affected. So that the people who are not infected know somebody who is infected, they're able to support that person and be able to give them positive enforcement and the enforcement to be able to live healthy lives.